Hey, hello everyone, and welcome to the show. We are live. This is Exposing Hidden Causes of Your Pain and Exhaustion. Are you tired of living in pain? Are you sometimes feeling unwell, tired, or outright exhausted at times? Do you sit in front of a computer for hours at a time? If so, this program is definitely for you. Welcome to the first of this three-part mini-series on exposing hidden causes of your pain and exhaustion. I'm your host, Dr. Dralanchong, the spine coach, with your co-host, Better Living coach, Elaine Cooper there on the film strip, and our special guest today, Dr. Christian MD, who is a medical GI specialist. So the premise for today is when a person is healthy, a healthy person equals a healthy life, healthy lifestyle, and also from a business standpoint, a healthy business for most people, for many people. And failing health, especially for entrepreneurs and small business owners, often means failing business because you are your business when you're an entrepreneur or a small business owner. So, Elaine, it's going to be a great show today.
I am so excited about this, and Dr. Christian Turbide, thank you so much for joining us today. Alan and I have been on tenterhooks waiting for your interview.
Yeah, exactly. And I did the pre-interview, which we're going to talk a little bit with Dr. Turbide, and he's got some great things to tell us that most people aren't aware of. So let me just, if I may, Elaine, highlight today's show. So on today's show, we're going to talk about pain and your gut, pain and your GI system, how it's related, structural relationships, anatomy a little bit, posture and alignment, and how even one's posture or even that the gut can cause low back pain and even arthritis. Secondly, through something we all know too well but often don't treat properly is inflammation. And Dr. Turbide is going to talk about that, which is the fire within. I love that. And thirdly, we're going to talk about common disease states, chronic pain, exhaustion, fatigue, these chronic diseases, even brain disorders very closely related to GI or gut health. Now, so Dr. Turbide, Christian Turbide, MD, is a practicing gastroenterologist at Foothills Hospital in Calgary, Canada. He is a clinical assistant professor of medicine at the University of Calgary with training in clinical nutrition, functional and holistic medicine from the Institute of Functional Medicine. He is an avid promoter of true health from within through his blog. And stay tuned, later in this show, he has a free download, a special report to give you all our viewers. Even those who are watching it in replay can pick that up. So watch for that and listen. You'll want to catch this whole show. And of course I had to throw in a few things about he can tell us all about our gut feelings, literally, inside and out. And he tells me he does colonoscopies for fun. Not really, but welcome, Dr. Christian Turbide.
Thanks, Alan, and thanks, Elaine, for inviting me. I'm very privileged to be here, and I'm very excited. I was actually very happy to have met you, Alan, because myself, I was thinking of being assessed for my spine alignment, so I was very happy to meet you, and our friendship is just going to grow from here, I'm sure of it.
Oh, it's awesome, and you know, likewise. So that's great, and welcome to the show, and it's a three-part show, by the way, and we've got you scheduled in 2 weeks' time as well. So what we don't finish discussing this week, watch out for in 2 weeks' time, Mondays, for this three-part series. So let's get right into the content here. We got some great stuff. Now, tell us about pain in your gut. How is it even related?
Well, one would not think that a gastroenterologist or digestive disease doctor would know a lot about chronic pain, but really we see a lot of patients that are suffering and deal with chronic pain on a daily basis. And really, the association may seem a bit far-fetched, but anytime that you have an interaction or sensitivity in your gut, you just remember that you feel it in your gut, but the perception is actually dealt with in your brain. If I could just translate to a limb or a hand or a foot, there's a phenomenon called phantom pain where you actually have a lost limb or a crushed hand or something like that, and then you subsequently feel the pain afterwards, even if the hand is no longer there. So that phantom pain is proof that we actually perceive the pain in the brain.
So you're saying that most people are treating pain, these pain rubs and all these medications and things are often partly addressing it, but not really addressing the pain wholeheartedly.
Yes. And I'm here today to tell you that I believe that chronic pain and the level of it and the persistence of it is actually aided and abetted by gut inflammation or gut issues. So if you are dealing with, undigested food or issues that we're going to talk about later in the program, that will subsequently influence your brain and your pain perception at the brain level. So it will increase the amount of sensitivity you have and maybe increase the perception of the pain.
Wow, Elaine, did you hear that? This is like almost some of the latest research. Now you're stating stuff that's not just speculation, right, Dr. Turbide?
Yeah. There's documented proof on functional MRIs that patients that suffer from a common illness that we call the irritable bowel syndrome, whereas you feel pain even if the investigation is normal, when you do functional MRIs, these patients have an increased sensitivity to pain. It's like their pain tracks in their brain have these highways that are telling them that they're actually suffering and they have pain. So they perceive pain at a lower level than you and I. And this is proven by functional MRI.
Wow. So tell us a little bit more about back pain. You said back pain and musculoskeletal pain can also be related to the GI system and maldigestion, if you will.
Well, we see in many illness we see a link between the digestive system and the lower back. Like if you have an infection in the GI tract, which subsequently causes inflammation and issues in the intestine, that can subsequently translate into back pain. We can have arthritis that can manifest itself, or vice versa. You can have disease entities that start in the intestine and then are subsequently associated with colitis. So there's a big, marriage between the two. If you're looking at gut inflammation, which can cause spinal inflammation or even joint pain, which are often associated with the two, with each other.
Exactly. So I know from clinical practice that if anybody has structural issues on top of inflammation and what I describe as an inflammatory type of person, then they're so much more prone to chronic pain and recurring pain. I think you've seen that too there, Dr. Turbide.
Yes, and like you mentioned posture earlier in the introduction, I think posture plays a big role in our perception as well. I mean, out of all the senses that we receive during the day, by far our body receives the most senses from our joints. So
exactly.
There's been some links between our posture and our thoughts, and these are documented at Harvard University, and even influencing your hormones like cortisol and testosterone. So the posture that you adapt during the day will then subsequently translate into thoughts and hormones. So a
That,
thought
that's
equals hormones.
and that is fascinating. We're going to have a look at a couple of posts right now. Rob Jacobs says really ready and excited to listen and learn. And Carrie says, where are we here? There you go. Ditto, Rob Jacobson. My 8-year-old has eczema, and we've got to address that a little bit later, which I am certain is tied to some gut issues. I think that can be substantiated. Dr. Turbide, yes?
Yes. So, go ahead.
Oh, yeah. So I was just going to finish the part about proprioception. Is the what you're talking about, the joint receptors and all that, so much tied to what goes on in a different part of the brain, but it's all connected. And what we're seeing, I believe you're saying, is that everything is so much more connected than we ever understood. You know, and can we talk a little bit about eczema now, as Carrie rolled on, asked about, which is moving towards discussing inflammation.
Yeah. Okay. So before I delve into the specific topic, we have to look back and we have to see what are the origins of most manifestations that we have. So we call it eczema. Someone else may call something. Another doctor may call it, you know, asthma, runny nose. You know, allergic rhinitis. You know, so these are manifestations and issues that chronic health challenges are often like have a source or an origin coming from a micronutrient deficiency combined with inflammation, chronic inflammation, and genetic susceptibility.
Genetics plus susceptibility plus environment.
Yes, there was a big study looking at identical twins originating out of Denmark, and these were identical twins, so same genetic code, and they looked at twins that grew up in the same house or in different houses, and they determined that the genetics will only explain about 25% of the length of time you will live. So if it's 25% genetics, that means 75% of the length of time you will live is due to your environment. And what are we talking about environment, Alan?
We're talking about diet and what we put in ourselves.
Yes, we're talking about everything that we're talking about today. We're talking about diet, the exercise, how much do you move in a day, you know, what are your thoughts, how do you manage your stress. So the things that we know are important, but we really don't realize how important they are. We need to put these things at the forefront. We need to increase their priority.
Like you mentioned, wow, fascinating stuff. Even posture and how we sit, ergonomics, is our environment. I mean, that's how joints break down. That's how people get back pain, neck pain, burning shoulder tension. Very, very common, along with chronic fatigue and inflammation.
Yeah. So
it all makes sense.
Just to come back at eczema, typically skin disorders are a skin manifestation of inflammation, and inflammation originates in the gut. So inflammation, which means fire from within. You've got a burning fire within you, and the inflammation is coming between the interaction of your gut barrier, exposing you know, irritants to the liver, and then the liver cannot detoxify everything at a you know, at an adequate pace, and then subsequently we have inflammation that is produced by the liver. Okay.
Tell us more.
So when you're eating, you're putting food on 2 tennis courts. That's how big your gut is. Okay. 2 tennis courts that is 1 layer thick, 1 cell thick. And right underneath that is 70% of your immune system.
Wow.
The food that you choose, that you eat, okay, will then either feed your gut or break it down. And then when you have a broken down gut, guess what's right underneath? Your immune system. So your immune system, whose role is to differentiate between self and non-self. So if you've got all these things that aren't supposed to be there, like undigested food, like bad bacteria, proteins, or whatever, environmental toxins. So as these things go down through our gut barrier and then expose themselves to the immune system gets angry, so the origins of autoimmune disease. And then there's a direct highway, venous highway between the intestine and then the liver. And then you get an overwhelming effect of the immune system, undigested protein and bacterial antigens to the or bacterial proteins to the liver, and then the liver he tries his best, but over time he gets tired, and then the liver starts producing inflammation.
Wow, so that's a great summary of that. Tell us more.
Well, the inflammation that is then produced, the fire from within, then goes to our genetic susceptibility. So if you have the ApoE gene, you are more likely to develop Alzheimer's. Alzheimer's is inflammation of the brain. Obesity is inflammation of the brain. If you have a sulfur deficiency, possibly an immune disruption and certain genetics, you will develop arthritis. That's where your inflammation is going to go. So that's what I mean by genetic susceptibility. I mean a weakness in the body to deal with a micronutrient deficiency and inflammation.
Right.
So
we have a question right here. Rob Jacobs says, are there pain perceptions altered after having, say, IBS or another gut issue, or are you saying that some are just more sensitive to pain in general?
The pain perception at the brain level can be changed over time, and certainly disease states and certain medications change your pain perception. So a person's pain perception will change in their own bodies, but also there are other things that we're less aware of, and that is genetics and ethnicity. So I myself, being a gastroenterologist and being a physician, and I'm sure you, Alan, you've noticed that, and Elaine as well, there are certain ethnicities that tend to feel pain more than others. So, it's an interplay between what are your genetics, but also what is the inflammation influencing at the brain level, and that will change the pain perception. So also there's a fatigue component. I mean, if you've been having pain for 3 weeks, you're probably going to tolerate a lot less than if you've had it for 10 minutes.
Plus people can't sleep well as a result of pain, discomfort, and all these cascading problems.
Yes,
right?
Lack of sleep never helps anyone.
Yeah, you know it more than most, right, as a physician.
Oh my God, yeah. If I think back to my residency, I mean, a word that comes up is frustration and bitterness. Honestly, doctors are empathetic and people that really want to help, but I have to admit, it's not a system that really encourages our own health.
Right.
There's a saying, a chef should eat their own cooking. Well, I think physicians should be healthy as well, and the residency program, the internship, is definitely a challenging time in your life for health promotion.
Certainly when we talk about environments, right? So one of the comments that Carrie rolled on, focused on, was that wow, 75% environment, energy, food, posture, lifestyle, thoughts, feelings, and emotions. Agreed. I mean, life is all that interplay, and some people are just more susceptible to certain disorders, not necessarily just by genetics, but certainly social,
yes.
Social and influences, societal, if you will.
Yeah. I think one of my life purposes is to educate people into accepting responsibility for their health. So
I love that
this
too.
is not a guilt trip. This is not like this is your fault. You know
Yeah.
what we're here to tell you today is that the times where the doctor or the nurse or whoever is going to hand you the prescription and help everything and cure everything is just not there. We're dealing with, when we talk about chronic illness here, we're dealing with a lifestyle issue, and lifestyle is what will bring you to the other side. Medications will probably help with symptoms, and I prescribe medications myself, but I'm aware of the fact that lifestyle is what makes the biggest difference, because lifestyle is the driver of the gut, problems and subsequent inflammation.
Right. And Elaine, what do you think
Hi.
of that lifestyle? We couldn't have scripted Dr.
We
Turbide better than
couldn't, no,
that,
absolutely could not have scripted it better
because
because
we're both lifestyle coaches on the other side, on the online side,
Yeah,
right?
yeah.
Exactly.
lifestyle is such a crucial point in our total health, from top of our head to the tip of our toe, and yeah, it's exactly what we're doing.
Coaching lifestyles, and there's so much more need for that. I see, Dr. Turbide, as you see that. I mean, many people are kind of dismayed about even the access to, we aren't going to talk about that, but even the simple access to a specialist like you. That's why this is such a valuable series of interviews, right? Because not only do we get this content, but we're getting some of the latest research and your findings and kind of correlating it with, yes, some perhaps controversial opinions, perhaps not, but there's certainly lots of research to support what you're saying, correct?
Controversial, that's a very good. I've been into some heated discussions with some dietitians, and I've eaten in a hospital cafeteria. I mean, a salad with protein, and next to me was a respirologist with a whole plate of pasta and a big muffin and a bun, dipping it in molasses, and
Right.
like this. This is this is what I face. I mean, a chef should eat their own cooking. I think we should be an example of what we want, and you know, we should be practicing what we're preaching. And I think you guys are living the proof, right? You're living the talk.
We're doing our best. But that, and we aren't here to critique that so much as to bring awareness to the fact that we all could eat cleaner, better. I mean, that salad, unfortunately, in your cafeteria probably is loaded with sulfite treatment to keep it from going brown, and unless it says organic, it's probably been well sprayed, especially during certain seasons of the year. These are all things that we need to kind of think about more so as an audience of our environment. And I love the fact that you, and Elaine, I know you're laughing because you're in the food world where you're talking about raw, organic, as good as it gets for clean eating. And I do my best to feed and be a mentor to my family to eat cleaner, but I've got teenagers too,
I've often struggled with that myself. I have young children, and you know what? I just do my best. I eat what I think is good, and I pray that they will model what I eat and someday make the right decisions. After education and modeling. Another aspect is your house is your castle. So if you really don't want chips in the house, you can't go buying them and then shouting at them if they open up the bag and start eating them, right?
Exactly.
Exactly.
Now, tell us about some of the other common disease states. We talked about chronic pain, but chronic fatigue, how does that relate to what people are eating and what we're eating? Chronic fatigue, exhaustion.
Yes, well, chronic fatigue and fibromyalgia, which is a muscle pain syndrome, chronic fatigue being, a fatigue, perceived fatigue state without any documented viral infection or any other illness like that, or cancer or anemia or things like that. So these states are issues at the pain perception at the peripheral level, so at the muscle level for fibromyalgia, or certainly at the brain level. And the underlying problem again can be helped by having adequate food or of a good micronutrient balance that feeds the gut, feeds the right type of bacteria, doesn't break down the gut barrier, and then subsequently doesn't overwhelm the liver with inflammation and immune system soup.
Mm.
That's a different kind of soup I wouldn't want to make.
No.
Interesting you said that too, Christian, because I was diagnosed with fibromyalgia 20 years ago, but it took them 5 years. And it really wasn't until 5 years ago that I actually made the biggest difference in my health. I have more energy today than I have had since my 30s. So having brought up a family and now having grandkidlets, it's a wonderful way to go into my midlife.
Yes. I myself, like you, have had issues, and believe it or not, being a gastroenterologist, I suffered from irritable bowel syndrome myself. And really, the breakthrough came for me when I took gluten out of my diet. So, I mean, I'm a patient just like anyone, and I thought that maybe with gastroenterology I'd be able to figure it out, but that's not how it happened.
So I want to know. I know our audience is going to be asking about gluten because what is it about gluten? That's a problem for many people.
Yeah, there are three. There's many issues with gluten, but when we talk about gluten, we talk about celiac disease, which is an immune reaction to a protein found in wheat, barley, and rye. That is your immune system attacking it, and then your gut is just broken down as like an innocent bystander. Now, let's not forget that 30% of the population have a genetic susceptibility for celiac, but only 1% manifest it. Why is that? Why is there a 29% difference between the genetics and the actual illness? And that's because it's more than the genetics. What celiac needs, or the celiac manifestation, this was published by Fasano in New England Journal of Medicine in 2012, there are three factors, and one is the trigger, the breaking down of the gut barrier, and then the right genetics.
Right.
So that is celiac.
Three things.
Yeah.
Three things to manifest.
Yes, and it's probably like that for most illness. So that is celiac disease. The second entity is gluten intolerance. So these are people that cannot digest the gluten protein. Remember, it's a protein found in wheat, barley, and rye. So these people do not digest it properly. They have difficulty digesting it, and they might be in the positive genetics, but not the celiac group, the 29%, or other group. And gluten itself, which is poorly digested, will actually go down and break down the gut barrier. So it makes a hole in the cheesecloth. Gluten making a hole in the cheesecloth, again, who's underneath is the immune system going, here I am, and what is all this protein that I'm receiving that I don't usually see like that? So It breaks down the gut barrier, overwhelming exposure to the immune system, and exposure to proteins to the liver immune cells.
Christian, can I ask a question of you? I think that might be on some of the minds of some of our listeners here today.
Sure.
Are there any tests, to determine whether you're gluten intolerant or celiac? I know there is for celiac, but if you're just gluten intolerant, there's so much back and forth on that gluten issue.
Yeah.
I'll have a client that says, well, you know, I've heard that there's nothing to this gluten-free thing. And, well, myself, I've experimented with it. So I feel a lot better off from it than I do with it.
Yeah, some authors argue that it's mostly placebo effect. Some say that there are other issues with it. So there are blood tests that you can do for celiac. There are some blood tests that are for we don't use for celiac, but are dedicated for certain particles on the gluten called the gliadin, anti-gliadin, and like there's a lot of genetic testing that are done by sorry, not genetic, immune testing done by private labs. You can order, I know probably personally around 7 or 10 blood tests that you can do. I don't do them personally. I do the recommended test for celiac, and I take the patient off gluten. If they have gut issues, irritable bowel syndrome, or other issues like that, that I'm thinking about leaky gut, which is probably pretty much every patient that I see, I tend to do a trial off gluten to see how they feel.
So are you suggesting that leaky gut is no longer this theoretical thing? It's pretty accepted?
There's a test where you swallow a sugar that is not digested called mannitol, and if you have mannitol in your urine, it's come through leaky gut because you didn't digest it.
Right.
They've done mannitol studies on patients in ICU, tremendous amount of leaky gut. They've done mannitol studies on patients, on Crohn's disease patients and their siblings, and the siblings which did not have Crohn's disease had increased leaky gut. Advil causes leaky gut, documented in the literature. So yes, this is a true entity, and it does.
Or ibuprofen, as it's known.
Yes. So we know that it exists. Now the issue is that we do not know exactly to what extent. So running a marathon will cause leaky gut. Do these people manifest problems? Maybe not. So where does leaky gut cause a problem and not? We're not too sure yet.
Right. But the suggestion, and I do want to talk about microbes and probiotics and such, and how, not the solutions, but it's a big problem out there with our messed up diet, lots of processed food, lack of micronutrients. You're saying the gut barrier is already compromised, correct?
Yes. Okay, so just to finish, I want to talk about gluten, but
for sure.
So like I said, there were three. There's celiac disease, there's gluten intolerance, and the last one is gluten allergy, where you actually swell up and you have an allergic reaction to gluten. That is not immunologically based. It's well, not the same as celiac disease. It's like an allergy. Now, I personally do not eat gluten for several reasons, and the number one reason is because it gives me tummy pain, but it's been linked to IBS, it's been linked to many issues, and probably eczema, combined with maybe the casein protein from dairy. So gluten and dairy are very difficult to digest. The second thing is that you can't eat, wheat just like that. It has to be refined, which means it's been milled, it's been gone through a processing, and there's a machine that took it and brought it down to its simplest form. When you do that, you lose a huge amount of micronutrients. 80% of the niacin, the B vitamin complex, is gone. Magnesium, 70% it's gone. The calcium is gone. So you're eating a slice of bread that has 5 teaspoons of sugar that is very low in micronutrients. That flour's probably been bleached, which means chlorinated, which again alters your gut bacteria. It probably has a great deal of pesticides, which we call glyphosate or Roundup, and the huge companies, Monsanto, continuously say that the glyphosate does not influence humans because we do not have the enzymes for it. But bacteria in your gut, which were more bacteria than human, do not digest glyphosate very well. So
Right.
it's altering our gut bacteria. So undigested protein alters the gut bacteria. The glyphosate and other, atrazine, other pesticides are altering our gut bacteria. We're not fermenting foods anymore. We're eating antibiotics. Our cows are eating antibiotics. They're pooping in the fields. There's now antibiotics in broccoli. So, our poor gut bacteria are just like, oh my God, I'm dying here.
Yeah. So
Trying
so the fittest and often the pathological or the nasty ones are surviving.
Yes. And they again, good food will feed good bugs, and bad food will feed bad bugs, and the bad bugs are what are breaking down our gut barrier.
Alan, could we take a question from one of our listeners, our watchers?
Is this Rob Jacobson?
Rob Jacobson was asking if there's any suggestions that you might have on additional supplements we should be taking in addition to clean, balanced food intake.
Here it is right there.
That's a great question, Rob. Now, I'm all off, like I'm sure Elaine is the same, and I'm sure Alan, you're the same. We need to get our nutrients from food. Real food, a well-balanced diet, and that is as wholesome and as organic as possible. These are the choices we make every day, and these are the choices that will feed our bodies. I personally, I try to increase my vegetable intake, so I take an organic green powder. I take a veggie smoothie in the morning of a salad, and I will add a green supplement, a green veggie supplement, dehydrated vegetables to that. I take other supplements as well that have been shown to enhance the gut, to help with gut healing, and because I'm constantly thinking about my broken down gut, and I'm trying to heal it as much as possible. So I can go into specific supplements that I take. Is that something that would interest you?
No, I think we're going to keep, I mean, we could be talking about all kinds of brands, and we might save that for 2 weeks from now. We'll certainly talk more about that. That's a great question there, Rob Jacobson. So I think we're going to need to move on. I wanted to just shed a little more light on how the lack of micronutrients. She said certain foods feed the good bacteria, certain foods feed the bad bacteria. Can you clarify what you mean by that?
Well, if you're looking at, remember micronutrient deficiencies, like if you're eating a high refined carbohydrate diet, which is the SAD or the standard American diet, of bread, pasta, cookies, and muffins and cereal, eating a tremendous amount of sugar, and you're eating a great deal of gluten, which is difficult to digest. Now, your gut bacteria is a balance between the good and the bad. So the good would be things like lactobacilli, bifidobacterium, and low yeast. Whereas if you're looking at a high sugar gluten diet, you're going to be feeding things like yeast, and you're going to be feeding other bacteria, like, I've just throw an example, gram-negative bacteria, which are linked to inflammation and issues. Now, if you have a mouse that is obese and you put bacteria in her gut from a thin mouse, the obese mouse will lose weight.
Wow.
So
did you hear that, guys?
That's amazing. Wow.
So bacterial flora is influencing genetic expression.
Yes, your bacteria flora, which is a result of your diet, is communicating with your gut, your inflammation, and then subsequently the inflammation will influence your hormones.
And of course the brain is an influence somewhere along the way too.
Yes, there's a direct connection between the brain and the gut. We call that the vagus nerve. Forever we thought that it was unidirectional, that it was going from the brainstem to the gut. And now we've discovered a direct connection in reverse. So we've discovered bacterial toxins in the cerebral spinal fluid, so the fluid around the brain in schizophrenics, more frequent than other people. We've discovered that autism children will start speaking more clearly if you give them oral antibiotic vancomycin that stays in the gut. So the brain manifestation is a direct correlation to the gut. And we think that it's through the gut barrier, liver inflammation influencing the brain, or the vagus nerve having direct access to the brain.
Fascinating. That's eye-opening, wow type material, as I talked
incredible. Just incredible.
Yeah. So we can. So basically, to summarize that last little bit, like the typical North American diet, grain-based pastas, not just wheat, even if it's gluten-free, if it's all mostly carbs and low in vegetable matter, is not supporting great bacterial flora, which could be expressing in so many of these disease states, especially when a person has predisposition.
That's correct. People that live the longest on the planet eat a wide variety of fruits and vegetables, at least 50% of their diet. 50% of the North American diet is bread, pasta, cookies, and muffins and cereal.
Right. So that alone is like a revelation for many. And how most people don't have access to a specialist like you on a day-to-day basis, certainly in most parts of the world, I would say. So what would you say, I mean, where does the average person get guidance? I mean, coaches like us, more informed, but is it through reading? Is it like, how do you foresee this awareness coming for a healthier society?
The question is, who should you listen to? So
partly
your doctor is your doctor and your nurse are very empathetic and they want to help you, but they come from the disease world. They're taught to find the diagnosis and find the right medication or the right treatment for that. Nothing, not that I'm dissing doctors. I'm a doctor myself and I prescribe medication, but I think, like I said, the solution for chronic illness, at least in part, if not the majority, comes from lifestyle. So if you want the lifestyle, the diet, the exercise, the stress management, you have to look at a mentor that has what you want. So you have to look at a mentor that is knowledgeable in cutting edge nutrition and lifestyle modification to make you healthy. And the way to do that is to really hear what they're saying, assess it, and see, do they eat what they cook? So does your doctor or your nurse or your coach, do they eat well? Do they exercise? Do they manage their stress? Are they a spiritual person? So that's how I think we should judge it.
Right. Yeah. Important stuff. I agree completely, Elaine.
100%.
Yeah. And coming from the, just entering the coaching world, what I realized actually is that I had been coaching my patients / clients for years and years, and I just decided to go online with it. Elaine, I know you've been working in that field for a lot longer, right? More coaching.
For a little while.
Better living coach, right?
Into the crux of it, and it's not just one, eating or lifestyle, it's both.
Exactly. And what we realized from this conversation more than anything today is I realized that, yes, it is multifactorial, and a person would probably need help from a few people, a few mentors.
Yes, I think so too. And that's why I was so happy to meet you, Alan, because I think alignment is a big part of it.
For sure. I couldn't disagree anymore.
Yeah, no one knows everything. And you have to accept responsibility, and you have to get educated. Now, having said that, it may seem overwhelming, but I have to say that it's a gradual process, and the key is to taking the right decisions as much as you can on a daily basis. And if you get off track, it's okay. You just try to get back on track as soon as possible, and you don't beat yourself up. You do what you can, one decision at a time.
Step by step.
Yeah.
Step by
So
step.
I myself, I didn't get to this point overnight. It took years and years, and Elaine, probably the same for you, I imagine.
Absolutely.
Yeah. Um, Rob Jacobson, thank you for sticking with the program here. I am sitting here trying to digest all this info, and wow, we promised you, Rob, and others, and those watching in replay, what an eye-opener. Tip of the iceberg today. Thank you very much. And remember, 2 weeks from today, on Monday the 16th, we've got Dr. Turbide in again for an hour show where please pass the word around and share it. So we want everybody possible to pick up this kind of information. And this really, I appreciate, Dr. Turbide, the shift to making us think as a classically trained physician. So I see we've lost him briefly there. I think he'll be back. But anyways, Rob, thank you for pointing that out. And this is stuff, Elaine.
It's absolutely incredible. I mean, you said, and I believe every word you said, but to hear it from Christian is just incredible.
Exactly, because sometimes we're sitting here talking to our patients about this, and we can't quote the research, but he knows the research, and he works with patients of the most difficult kind, like Crohn's patients who are, some of them dying, probably unnecessarily, or getting extremely sick because they just didn't know how to start doing something about it from the beginning.
Something different. It's not the traditional, follow this, follow. It's looking outside of the box and seeing where the problems are coming from. I mean, absolutely incredible.
Yeah, I agree. Now, I believe that I know his internet connection was starting to fade there. We could see that we were losing him a bit. But Elaine, let's continue the discussion a bit. We're going to be wrapping up in about 10 minutes. But before we do, what's in store for the next couple weeks? Should we tell our audience that?
Let's give them a little teaser to show them what we've got in store. I told them it was going to be fun.
Right, exactly. Well, next week, our show is going to be 2 guests. We have 2 successful entrepreneurs and business people, and coaches, I believe, as well, who work with people in various different fields, who almost lost it all due to health problems. Health problems that they probably could have prevented, but we're going to hear their story next week, that threatened their lives at one point. I know Joe Pay did share that with me, and threatened their careers. So that's next week. Next week's show is at 6:30 p.m. next Monday, February the 9th. And then our third in the series, again, as I mentioned, we will be having Dr. Turbide in again on February the 16th at 6 p.m. Again, 6 p.m. Mountain, so it's 5 p.m. Pacific and 8 p.m. Eastern. So come to that. And also, if you forget or don't see the notifications, you can always check us out and Google me or my website, thespinecoach.com, and click on the show that has the latest information, or Elaine Cooper's website, Your Better Living Coach. Just Google that, can't miss her, and click on her 3-part mini-series to find more information about the show. And next week's show is going to be super exciting too, especially for people who are business owners, entrepreneurs, small business owners. They're going to share their real stories and what they did to turn things around.
How it's changed for them.
Exactly. So, yeah, that's some great information. Nadia here, I'm just going to read here, Nadia. Imagine all what has been said plus chiropractic treatment, the perfect combination. Thank you, Nadia, for that endorsement. Obviously, you have a lot of experience with that. We look forward to having you as a guest in audience again with your engaging comments.
Carrie was on here a little bit ago, and she talked about she had to leave a little bit early. Carrie Roldan.
Yes.
And she talked about her husband. When she's going to make sure that he listens to this in replay.
Yeah.
So,
I really know because I was happy to be able to do the pre-interview with Dr. Turbide to prepare for this show and do the research, and I was just blown away by some of the stuff he's sharing. And like ibuprofen, we knew that it affected the stomach, but even makes and causes, at least temporarily, causes leaky gut. And of course, leaky gut syndrome is simply the passage of molecules through the gut barrier that should not actually be passing through normally, and therefore it goes right to what's next door. As Dr. Turbide said, right next door is 70% of your immune system. So
why are we getting all of these autoimmune diseases? Kind of ties in, doesn't it?
Exactly, and for sure in 2 weeks' time we are going to be addressing autoimmune disorders and even dementia, Alzheimer's, which he talked a little bit about. He feels is mostly related to chronic inflammation in and around the brain. So we're going to get more into the nitty-gritty and certain conditions that cause pain and fatigue and exhaustion in 2 weeks' time. And next week, of course, we have the if you will, the case studies of people, how they overcame pain and exhaustion and perhaps even death. They've gone through a lot that put their careers and their lives at risk.
Their lives. And I would love to hear from anybody that was listening or is listening on the replay to have any comments whatsoever. We'll both be on the feed and would love to hear comments.
Yeah, that's a great point. And also questions. I know Dr. Turbide is a very busy specialist, but certainly we'll be picking up the comments both in replay and the ones that have been coming out of here in the next few days. So how you can watch out for next week's show with the exact event page is keep, circle Elaine, circle me. Elaine, you're at elainecooper, correct?
Yes, I am.
And I'm at dralanchong, and you can certainly go to our websites. Mine's thespinecoach.com, and what is yours, Elaine?
yourbetterlivingcoach.com.
yourbetterlivingcoach.com, obviously. So looks like Dr. Turbide had to go. I know it was the end of his days, worked a long day already, so we're going to wrap up with a few things. The call to action, of course, is join us next Monday at 6:30 p.m. 6:30, not 6, 6:30 p.m. Mountain, 5:30 p.m. Pacific, 8:30 p.m. Eastern, where we have two successful entrepreneurs to tell us their stories and how they got over pain and exhaustion that threatened their careers. So watch out on the event page that's coming on Google+, Facebook. Elaine and I are going to be posting on Facebook, certainly Google+. And until next week, I guess we're wrapping. Until next week, on behalf of Elaine Cooper and I, Dr. Dralanchong, make the choice to live pain-free and energized. We'll see you next week. Thanks for watching.
See you next time.